To further explain stress, like I said, because it involves the mind and the body both, it's a reaction of the mind and body to everyday challenges and demands. It can appear very quickly and go away very quickly as well. Like one of the examples I've mentioned here is running late for the bus. It can slowly build up over days as well. Examination, interviews, meeting deadlines at work, preparing for a wedding, also going through some grieving processes it can build up over time. Usually acute stress is brief and chronic stress we refer to as long time. However, it is not so either or. It can also be a combination depending on the context of how we are experiencing stress. The intensity of the stress we feel towards any experience that we experience is coming from what we have learned growing up as maybe very difficult to handle, or we feel inadequate to handle. So and that is what we call perception, because somebody may feel, oh, this is so, exams are very easy to prepare for and pass, and somebody else may really struggle with it. And both have their personal realities. So one of the other contributors to the perception of stress is also the archived experience. Maybe something that I experienced earlier on gets added to what I am feeling in my current day, and it gets, I may have a reaction which is larger than necessary to handle the situation. Sometimes road rage is a good example for that. This is a picture I found on the internet, and I thought it was very interesting because it spells out the word, and it spells out the solution it has in the word. Though I don't agree with the smoking. So it says speculation, T for time management, R for relaxation, E for exercise, and S for smoking. That's the one I don't agree with. And self-satisfaction. Response, how do we, so we, going through life, we experience both positive and negative stressors. How do we respond to stress? Some of the positive stress we feel, like deadlines or exams, it makes us go on to the next goal of our life, and it makes us more, it makes it more familiar to us to go through to go through a challenge, because then it increases productivity, and it also helps us to focus more, which is concentration. It can also be a motivator to solve problems and also have more goals, place more goals, because now I can do this much, so main aage bhi kar sakti hu. Managing acute stress sometimes can be challenging, and negative stress is when it starts to interfere with the ability to perform. मन नहीं कर रहा कुछ करने के लिए, या बहुत distracted हूँ मैं, बहुत जल्दी रो पड़ती हूँ, या zone out हो जाती हूँ, impatient हूँ, frustrated हूँ, or even angry. So if there is some behavior change, and one doesn't really, sometimes one may not really know that they're stressed, but it can show up in behavior, and that is something that one can pay attention to by talking to someone else, or even introspecting by yourself. Prolonged negative stress damages health, for sure, because the body can only take in so much and no more. Whereas the mind, I think, has the ability to process a lot more. But if your body is trying to tell you something, then it's time to listen. What are the causes of stress? So the cause of stress is called stressors, which is the source or the stimulus that causes the stress. So like I said, when you go through exams, so exam is the stressor. There are two kinds of responses. There's eustress and there is distress. I think we are more familiar with the word distress because we all use it at some point of time or the other, which is the harmful response to a stressor. When you're distressed, you may act out the stress by anger, by irritation, by social withdrawal, and a lot of the other things. Whereas eustress is a healthier way, like if I'm feeling a little bit of stress, I may think of talking to a friend, or I may try and go for a walk, or I may try and reach out to a family member or someone else who I think I can share with, or maybe occupy myself, distract myself into music, some form of creative activity, or even work more. And this is a chart where pretty much this is kind of explained in a pictorial way. So what are some of the stressors that are common for all of us? To top is, I think, life situations, because life goes through different contexts, different challenges almost on a daily basis. We see some of them coming, we don't see all of them coming. So some we are kind of prepared for, some we are not prepared for at all, and some we actually prepare. It's a combination, but each experience will have an impact. What life is bringing to the table, we don't have a control over, but how we respond to it, we can change, or we can work around it. So that is why it helps to know what are some of the common stresses. So school demands is yet another one, and school demands are both for children and for parents, because if the child is distressed, so is the parent. Sometimes even the parent is even more distressed than the child. Problems with friends, bullying, peer pressure, family problems for sure, abuse in any relationship, whether it's family or workplace, moving or changing schools, which it could also be change of cities, countries, but from a child perspective, schools is a big thing. Sometimes even changing houses and going to a different locality causes some stress. Breaking up with a girlfriend or a boyfriend, for sure. There are some environmental stresses as well, such as natural disasters, threat of terrorist attacks. Some of these could be real, but some of them could also be like, I have known of people who just have that fear that something will happen. So for them, carrying that fear is also becomes a reality. So I want to differentiate here that part of it is real and part of it is perceived. Fear in itself is a huge stressor of any kind. Biological, there could be biological stresses such as changes in the body, illness, injury, disability, any kind of loss of hair, maybe getting specs, not being able to recover from something like a flu, or, like a lot of people who went through the COVID had very long lasting effects on the body, which were also causing certain biological stresses. Next is cognitive, which means that thinking of oneself as not adequate or not good enough could be a stressor. Personal experiences, like when personal appearances, such as one could be too tall, too fat, too thin, too dark, too short, too many pimples on the face, very scanty hair, a perception of self which doesn't allow that person to fit into the social groups or the work groups by just accepting who they are. And that it's a huge stressor because it's like almost जितनी बारी सांस लेते हैं उतनी बारी वो याद आता है कि I'm not good enough. So it needs to be managed. Personal behavior, taking on a busy schedule, like sometimes people can have the tendency to take on too much. पता भी होता है कि बहुत सारा कुछ ले रहे हैं पर ले लेते हैं because हमारी आदत होती है कि हम एक चीज से दूसरी चीज में जल्दी जल्दी जाएंगे तो it's addictive to do that. There is a feel good factor also that comes out of it at the end of the day because you feel, oh, you've gone through so much, but it also exhausts you if you do it day after day after day. Using alcohol or other substances, this is a stressor, but this has a double effect because one goes to have alcohol or use other substances because the feeling is that this will numb the stress that I'm experiencing or the pressure that I'm experiencing. However, using it also causes more stress because the aftermath of consuming alcohol or consuming a substance, one doesn't feel very great the next morning. So I think I forgot, I missed out the relationship issues and smoking, but I've also mentioned that earlier. What causes stress for one person may not be perceived as stress for another. So it's very individual and very peculiar to every human being. So in psychology, we have, the research has established that there are some general adaptation stages to stress. So as your body experiences how to respond to stress, physical and psychological, both, the nervous system and the endocrine system are also involved. They're active when you're experiencing this stress. So there are 3 stages in how we experience the stress. First is the alarm, where most of you may be familiar with the fight, flight, or freeze response, where you get information or you come to know of something which is alarming. So you literally go through an alarm phase. Then you go through a resistance phase because I don't want that to happen. So it's literally like you're resisting and pushing the experience away, hoping that it goes away, except that it doesn't. So and actually resistance has, it takes a lot of effort because to push anything away, it does take a lot of effort. But it also helps to build up your resilience because आप जितनी ताकत उसको push करने में लगाते हो, there comes a stage where you feel कोई चारा नहीं है, but accept करना है. So that the fallout of resistance is resilience. The third is the fatigue. When there is prolonged stress and the body has the ability to adapt, but when it starts to actually feel tired, certain symptoms may show up. You may, the first things that you may notice is maybe loss of memory in certain things, and you don't feel like waking up in the morning. Your energy, your physical energy level is not the same as it used to be. So this is the adaptation. The fatigue actually helps you to adapt. So again, there is a positive and a negative connotation to all 3 stages where you experience it and then it goes, and then you learn something at the end of it. So some of the reasons we go through chronic stress is primarily the #1 reason, in my experience of having spoken to people, is the inability to say no. बहुत बार मन करता है ना बोलने का, लेकिन हम हाँ बोल देते हैं क्योंकि हम नहीं चाहते कि लोग हमसे नाराज हो जाएं, कि हमारे रिश्ते टूट जाएं, या हम ये भी नहीं चाहते कि दूसरा इंसान ये सोचे that I'm not a nice person. The inability to say no also is very closely linked to people pleasing, because I want to please everybody. I want everybody around me to be happy. That's a lot of burden to carry. That in itself is a huge chapter in causing and remaining in stress. Third is feeling obliged. Like there are certain values, there is certain parental programming, or even your own programming, that you should be doing certain things in a day in a certain way, and that needs to be done. So, it would be, maybe you would resonate if I've written, if you call it the should be, could be, would be. When you keep thinking about ye करना, ये होना ही चाहिए, ये हो भी सकता था, ऐसा होता तो ऐसे कर भी सकते थे. So it keeps you in a loop of thinking, which is pretty paralyzing, because there's not much you can change in whatever's happened, but it helps you to keep occupied, and in a way, you could call it like problem-centric thinking, because you keep ruminating over the problem and it multiplies the problem in your head, which is causing you stress psychologically and physically. Relationship issues. Boss, partner, children, in-laws, financial, terminal illness at home, caregiving to someone who's been ill for a long time, or hospitalization, all of that. So these are reasons for prolonged stress, some of them. I'd be happy if you could share some of the other reasons you may know or may have experienced. And then everybody else could also know about it. And you could put that in the question answer thing after I finish. Okay, yeah, so the last thing that I'd said was relationship issues. And so broadly, I mentioned that we need to manage 3 types of relationships. One is the relationship we have with ourselves. The other is the relationship we have to people and life on the outside. And the third is group relationships. That could be family, could be social gatherings, could be teams at your workplace. And each one of them could be a stressor, or a combination of any one of them could be a stressor as well. So how do we know that there is chronic stress happening? So what's the impact? Some of the things that you may feel are, there could be changes in your personality. You may feel demotivated, disinterested. You may lack enthusiasm to do anything. Isolation, body manifestations like physical fatigue, or you just don't feel like exercising, don't feel like going out, and also social withdrawal. I think one of the things I may like to add here, which I haven't written, is spending a lot of time on social media. That, I think it's considered to be a stress buster, but it also induces more stress. So it's kind of a vicious circle. This is, again, continued impact of chronic stress or any kind of stress. So these are some of the changes that one may feel. Like in the body, it says fatigue, breathlessness, skin irritations. You just take a minute and read it or take a picture of it. It is available on Google, so, and I've given the reference as well. So to prevent stress, we need to feed all 4, which is the body, mind, spirit, and emotions. If there is a regular mental diet, which is consistent, it can help you maybe not feel the stress too much, or also reduce the impact of chronic stress. So exercise, physical activity, it's important to be physically active, like doing things, nutrition, and listen to your body. And the mind, increase your mental agility. Sometimes I think it also helps to play games because it kind of distracts you. I'm taking a risk by saying this because I'm not saying that you need to do that for hours and hours in a day, but like 5-10 minute, 15 minute brain gymming करने से फर्क पड़ता है because energy cycle change होता है. So, because normally ज़्यादातर हम लोगों की life होती है work, home, children, if we have children, family, and all the other things related to it. But again, so to break that cycle of energy, if you do something different, it helps you to recharge. Emotions is something that we overlook a lot. I think it's important to talk about what you're feeling and just talk about it. जरूरी नहीं है कि उसका solution हो. अगर आप उदास हो तो ये कह देना कि आप उदास हो पूरे दिन में, बहुत गुस्सा आ रहा है, उसके बारे में बात कर लेना is enough. So all I'm saying is to take care of emotional well-being, acknowledging what you're feeling is important. Some of the things that I may say may sound very trivial, that what's the big deal about doing it? But you will know the benefit if you do it every day, or at least try and do it as often as you can. Consistency is what gets you to a successful place. So if you don't want to feel stress, you need to be consistent with feeding the four parts of your life, which will help you to become a healthier version of you, a better version of you. Now I come to the reduction strategies that can help you live a more positive and energized life. So the first one is to identify the stressors. So if you could figure out what the trigger is, make a list and question your unhealthy habits. What about unhealthy habits you use to escape or avoid dealing with the issues, and what are the changes you would like to bring in? And third is that maybe you have past regrets that affect the present, or the lack the ability to forgive yourself or others. This is a very important one, and I think essentially what I am talking about here is holding grudges, because grudges को जब हम hold करते हैं तो हमारी बहुत एनर्जी लगती है उसको कंटेन करने के लिए. जब करते ही रहते हैं तो हम भूल भी जाते हैं कि हम कर रहे हैं और आदत सी पड़ जाती है, लेकिन फिर भी वो अनहेल्दी ही रहता है. Stop procrastinating. The fact that, and I think each one of us has a tendency to say, we'll figure it out later. We'll do it. कल करते हैं, परसों करते हैं. So the delays also increase your stress levels. Third is keeping your balance. So I've given you 6 strategies here. So the third one is keeping your balance, which is protecting your time from overcommitments that you can't control. And this is very important because, especially in a place like Delhi, there is the tendency to do one thing after the other. And it's very hard because we do have conditions that also play a role, such as traffic and long distances. So you would feel better if it's better planned, which means that it's spaced out. You can still do everything you want to do. Fourth is avoid negative escapes, which means that when we are stressed, it's tempting to turn into excessive eating, spending, binge watching, substance abuse, over shopping, over socializing. So it's important to keep a watch on yourself. If you feel that there is a behavioral change, or you are indulging too much or spending too much time on something that you don't really feel that you need to do, then please do take accountability for that. We usually do this because we feel, oh, it's going to change my mood. Number 5 is break out of isolation. Supportive relationships are very important. So if there are feelings around loneliness, then it's very closely linking to depression. So it's important to address it. And the sooner you address it, the more effective it is. The longer you wait, the harder it becomes. Research has established that people who are involved in faith communities or even social work communities tend to have lower levels of anxiety and stress because they have a purpose and they feel they have meaning in life. And that is a big one for relieving, reducing, sometimes not feeling the stress at all. Take good care of your body, which I think everybody knows that eating right, getting enough sleep, exercising regularly, improve your mood and regulate your emotions is very important. Those are the key things in taking good care of your body. This is the wheel of life diagnosis and the numbers are according to the size of the numbers are as, they signify the importance. Well, health being number 1, relationships, career, money, spiritual, personal, family, and friends, which basically means that we need a balance of all of this. And if you feel that you don't have one of these compartments in your life, then maybe that's something that one can introduce. Or figure out a way to, belong. Because like relationships, family and friends, spiritual, personal, all these 3 give you a sense of belonging, which is the primary need of life. Health, money, relationships, family and friends also they fulfill the basic need of connectedness, rootedness. Career gives you a feeling of purpose and meaning. And these things are important these are essential ingredients that we need in our life to take care of having the minimum amount of stress possible. And here we come to the last slide. This is basically a summary of wellness. It's a summary of wellness and it's put in a wheel. This is your work towards wellness and balance, and it's very closely linked to the previous one, which is the life of diagnosis, because this is more detailed, as in you rest, relax, you create. So creativity being an essential ingredient of life as well. It's important to have joy and do things that help you to just feel the freedom. It's very important to feel what you are meant, like what you're born to express, to be able to achieve the highest, truest expression of yourself as a human being. And with that, thank you for listening to me. The physical indications of stress in children are primarily change of behavior, irritability, and with children, it's a little bit more simpler because they will try and avoid or say no to doing something that is the trigger for them. So for example, stomach aches, school nahi jaane ke liye, या just the child comes and says कि मुझे school नहीं जाना है. Too much of clinginess upon either one of the parents. These are the small things which are the indicators. Of course, there's a long list, and it's very specific to each child as well. And I feel that one of the things one can engage in is to ask them to do some drawings, and the drawings can, maybe if the parent can interpret what the drawing is, they will tell you whether the child is having some sort of stress and where it's coming from. Is mental trauma a form of aggravated stress condition? I'm not so sure what the question means, but trauma in itself is stress, and prolonged stress can also be translated into trauma. So I don't know what the trajectory is here. However, it's interdependent and interlinked. How to know stress is getting alarming and seek doctor's advice. If there is any kind of dysfunctionality that is creeping in, like you want to, socialize and you're not able to, there's isolation happening, बहुत ज़्यादा loss of energy हो रही है, fatigue हो रहा है, loss of interest हो रहा है, lack of enthusiasm है, lack of interest है, बातचीत करने को मन नहीं करता, बहुत रोना आता है. All these are indicators that you need help. In fact, इसको crisp कर देते हैं. 5 of any of these symptoms are enough to say that you need help. How to deal with chronic illness depends on what the illness is. But there are two things. One is the person who's going through the illness, and the other is the caregiver. For the caregiver, the methodology will be different. It's very important for the caregiver to take care of themselves, and that taking care of themselves would have many different formats. Like it's important for them to socialize. It's important for them to get into activities, work, spend time. Like I said, break that energy cycle. And for a person who's chronically ill themselves, again, it depends on what the illness is, but jitna bhi potential ho, kuch बीमारी के बारे में सोचने और उसको एक्सपीरियंस करने के अलावा वो करना चाहिए. I already suggested 6 tips to reduce stress. And the 6 of them, like I had mentioned, was to identify your triggers, to stop procrastinating, to keep your balance. And if you're asking for activities, if you're asking for things that you can do when you are stressed, take very long walks, sit in the sun for 10 minutes, do some deep breathing, listen to calming music. Even when you're asleep, put on some music which sounds like raindrops or water trickling sounds are extremely relaxing for the mind. Yes, definitely because when you sleep, when you physically sleep, your mind is at rest. But if you have a sleep disorder, then your mind is not being able to relax and switch off. So there is some sort of a stress. And stress also is a word for fear and anger. Too much of social media and stress? Yes, good question. Social media encourages people to compare and compete with things that are presented in a pictorial form or an image, which is a moment. It is not the trajectory of life. And thereby, because of the constant comparison, and it gives you feelings of, I'm not good enough to be like that, or I'm not happy enough, I'm not rich enough, I'm not educated enough, I'm not beautiful enough. And that is how the stress builds up. I'd like to add to that, actually. It's also because what is being presented by other people is their reality, and it's not your reality. But when you see it, then you just feel like that reality is better than your own. And that's what I mean by comparison. More stress during night, is it correct? Stress is not correct at any given point of time. If it's at night, then it will definitely have a, and if it'll, so the morning is important because it sets the tone for the day, and the night is important because it sets the quality of your sleep. So if you're stressing at night, then the quality of sleep will be affected. Stress of targets and family time. It would help. It would help to train your mind to not think in forms of comparison and competition. It would help to understand that you are your own competition and you are your own comparison. So as long as you are becoming the next better version of yourself, and as so long as you are doing better than what you were doing earlier, that needs to be the thought process, not comparing with others. It has to be self-comparison and competition. Very highly recommended. Very highly recommended. Any kind of vigorous sports, gymming, walking, jogging, running, swimming, gymnastics, ballet, everything is very good for stress. And it's good for stress because like when I began talking about stress, I had said that stress is felt in the mind and in the body. So if exercise is a great way to break it out of your body, and it changes the energy that's going to your mind. So it's a great thing to do. It's very remedial. Thank you for having me here. And I hope you benefited from whatever little information I could bring to share with you. So thank you, everyone. Have a good day. Bye.